Hello and welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Gladwell Dental.
And in today's episode, Professor Schmidt is taking us to class. We're going to scan school.
That's right, I hear that bell.
Yeah, Will, what's on the blackboard today?
I tell you what, today we're going to scan 6 units on the same patient using the iTero Element 2 scanner. Dr. Mershon has a patient with 6 anterior units.
Awesome. And I hear you're also going to teach us how to speed up entry of tooth information on the RX?
Of course, and some tricks for tissue retraction because we are scanning each tooth individually. It's a jam-packed show. Let's get to it. Welcome back to another exciting episode of Scan School. The bell has rung. Let's get down to business. Throughout this series, I have progressively presented cases that range from learning the basic operations of the scanner up to actual scanning and submission of prepared treatments for restorations. If you are just tuning in for the first time, take a moment to glance at some of my previous episodes, especially if you are a beginner with the iTero Element scanner. Today, we are going to level up from a single prepared crown case by now acquiring information for a 6-unit anterior cosmetic crown treatment. Let's start by entering the specific information for each tooth we are scanning. In today's treatment, teeth 6, 7, 8, 9, 10, and 11 are the units to be restored. The dentist has already prepared these teeth, and I've waited until after the preparations were finished so I could properly acquire and then record details such as the stump shade and the margin design. You'll notice when I highlight the first tooth and select the crown option, the drop-down menu opens and a wide array of design features are shown that need to be entered. Now, this is the standard information that needs to be entered for any case, whether it is 1 tooth or 10 teeth. However, entering all of this information individually, even for 6 teeth, can still be time-consuming. So, iTero has built in a feature to assist with expediting the input of that information. Complete the first tooth's data entry manually, then go back to the previous menu and select the next tooth. Once that menu opens, you'll see a new drop-down feature in the lower left-hand corner of the screen named Copy from Tooth. I'll open that up and select a previous tooth that already has information entered. Now, all of the specifics that were entered for the tooth I selected are automatically copied to the tooth open on the screen. I can now exit that menu and choose the next tooth in the series. As I select More Teeth, you'll see that the Copy from Tooth menu includes the teeth that already have information entered. Well, this is important to know because every tooth may not have the same specific information, such as the stump shade. Take, for instance, this tooth number 9. I'm entering the information manually because the stump shade is ND7 instead of ND2, as the previous units 6, 7, and 8 are. Subsequently, down the line, tooth number 10 has the exact same specific information as number 9. So, I'm able to simply select Copy from Tooth number 9 in the drop-down menu. Then, finally, tooth number 11 has the same information as tooth number 6, so I copy from there. Additionally, if you still want to go back and change specifics on an individual tooth, you can click on any of the units with information previously entered and then change them manually. Don't worry, this change will only take place on the tooth you've selected and is not going to translate to any other units that may have been copied to or from it. I'm just going to finish entering the dentist's material request in the notes section here. This doctor is asking for Bruxer Aesthetic solid zirconia crowns, and that is another reason why I was so diligent about recording the best stump shades for each unit. In the meantime, while I have been entering all the prescription information, our dentist has been placing the retraction cords and preparing for the scan process. The double cord technique is being used for these units today. Proper retraction is so critical because we really need to capture all details of these margins, and we don't have the luxury of injecting impression material into the sulcus to make up for any overhang of tissue. Anatomical compra caps are also placed after the cords are packed. This patient is asked to bite together, and the caps are left for a period of about 5 to 7 minutes. So this is the point where a multi-unit scan becomes very technique sensitive, and it's important to perform these steps to the precise level that I'm about to demonstrate each time. If you remember from my single unit crown preparation scan episode, the iTero will require you to scan the prepared tooth, the working arch or quadrant, the opposing, and then register the bite. In the event that more than one unit is to be restored, each unit must still be scanned individually first. This rule applies to no prep restorations as well. I'll click through the options here on the selection map to show that each unit from 6 to 11 is able to be singled out. At this point, I'm going to remove the series of compra caps. This leaves me still with 2 cords packed into each sulcus. Now, since I'm dealing with multiple units that have to be scanned individually, I have to be very detail-oriented with these next steps. At this moment, the maintenance of tissue retraction is my highest priority. I have tooth number 6 selected on the screen to start. I'm going to remove the top cord from unit number 6 only. I'm now going to perform what I call the 5-second scan. This scan is to acquire all of the details of the preparation of tooth number 6. This scan should be completed in roughly 5 to 10 seconds if possible. I'm not worried about capturing anything else except for number 6 exclusively at this point. Once I'm satisfied that I've acquired the proper data, I'll give it a quick look to confirm and then press and hold on the green occlusal marker and move it to the center of the incisal or occlusal position on the preparation. Moving on, I'm going to perform these same steps for tooth number 7. I'll once again remove the top cord only. Give a second look to make sure the removal of the cord does not dislodge the remaining cord or even one in an adjacent sulcus. Once you're ready to scan, dry the area and once again perform a 5-second scan of this preparation's details only. Review it once completed and move the incisal locator dot as a final step. I'll move quickly through these next stages, but the workflow remains exactly the same for each unit. Remove the top cord, check for marginal visibility, dry the area, perform a 5-second scan, and then reposition the green locator dot. Let's do this for tooth number 8, 9, 10, and 11. I also want to mention that the removal of only the top corn is a guideline. If sulcular bleeding is negligible, and you are able to acquire a better scan with no cords left in place, then by all means, take both out. I do, however, want to stress that it is important to perform cord removal on a tooth-by-tooth basis. Now, I'm not showing it here in this presentation, but once all prep scans are completed, and before the full arch scan, remove all remaining traction cords that may still be present. Now that all the individual units are scanned, take one more glance through each one to make sure all of the marginal details are captured to your satisfaction. If any details need to be rescanned, it's best to simply erase that prep scan completely instead of trying to add to the existing or use the fill tool. I've taken the lip retractor out of the mouth at this point. I mentioned in a past tutorial that I prefer to perform the full arch scan portion with no distractions such as retractors or mouth mirrors if I can help it. When scanning cases with preparations, whether single or multiple, I like to perform the full arch scan on the working arch first and then continue to the opposing. Always start distal to the most posterior tooth in the arch and on either side that you feel most comfortable. Scan the occlusal surfaces. Angle slightly lingual on the anterior and then reach the same distal destination on the contralateral side. If you are proficient enough to continue the scan by rotating to the lingual, then it is perfectly acceptable to continue without stopping. The interproximal data can be reached by tilting the wand upwards towards the ceiling on the maxillary arch or down towards the patient's chest for the mandibular arch, then rocking laterally side to side. Once the full arch lingual data has been acquired, stop the scan and review. Now begin scanning the occlusal surface until the scans mesh together and then move to the buccal surfaces. Acquire the interproximal data by rocking the tail of the wand up and down as it travels to the midline where the scan can be stopped. Perform the same process from the distal occlusal of the contralateral side. Move towards the buccal surface and travel to the midline, stopping when the buccal scan meets the previously acquired data. Take another look around the arch after completion to make sure nothing needs to be filled in, and if not, continue to the opposing arch scan. Today, the lower arch is the opposing arch to be scanned. I'm not going to focus so much on this arch's scan in today's tutorial. The process remains just about the same as the working arch minus the preparation scans. One change to this opposing arch's scan is the addition of anterior incisal edge scans. Any full arch scan without a tooth preparation requires an incisal edge scan. Start with the wand on the incisal edge of either cuspid area and rock from incisal to lingual and then to the buccal. Stop this scan and move to the contralateral side where the motion is replicated. Each of these incisal edge detail scans should take no more than 5 seconds each to acquire. The final information to scan is the bite registration. After selecting the bite registration option on the visual chart, place the wand in either vestibule and ask the patient to bite in centric occlusion. Start posterior and move the wand in an S or a zigzag motion towards the anterior until the arches mesh together. This scan can be stopped after the mesh, and then the process can be repeated on the contralateral side. It is important to always capture the bite registration bilaterally on any full arch scan. After ensuring that all scans have been completed and meshed properly, select the View icon and allow the unit to clean up the scans and present them in a high-definition format. From here, you can view the occlusal clearances in a color map. These clearances are set to the final restoration material that has been chosen for this particular case. The occlusal color map can also be turned off if desired, and each preparation scan can also be viewed individually in a post-processed, high-definition state. When you are all finished, give the model one last review, and then press the envelope icon to send this case to the lab for final fabrication.
Thank you for that, Will.
Not a problem, Megan. And check out this week's free featured CE course, Clinical Success with CAD/CAM Restorations by Dr. Justin Chi.
That's right, you gotta head over there and take that free course because he's going through the entire clinical workflow for a CAD/CAM restorative process. So head on over to glidewelldental.com and take the course. But for today's episode, we're all wrapped up. So thank you so much for watching.
And we'll meet you right back here next time.